everyone, welcome or welcome back to Sowkya Vision. Today we are going to discuss cubital fossa. What is cubital fossa? Cubital fossa, it is a triangular hollow space that is present in front of elbow. Yes, it is a hollow triangular in shape containing a base and an apex in front of elbow. So the base is present upwards and apex is present downwards. Yes, base is present upwards and apex is present downwards. It is a triangular fossa. Yes, it is a triangular fossa. It is corresponded to popliteal fossa in the lower limb. Yes, in the lower limb we are having popliteal fossa behind knee joint. Here the cubital fossa is present in front of elbow. Yes, this is the cubital fossa. This is the base. This is the base and here it is the apex. So it is a triangular fossa that is present in front of the elbow joint. Yes. Now let's see the boundaries and contents of the cubital fossa. As it is a triangular fossa, it contains a base, apex, medial, lateral, floor and roof. So what is the medial boundary? Which muscle is forming the medial boundary of the cubital fossa? It is the pronator teres. Pronator teres is going to form the medial boundary of the cubital fossa. See, this is the fossa. Yes, here it is the arm, elbow joint and down forearm, right? So this is the triangular fossa. This is the triangular fossa. So this is the medial side, right? The medial side, it is bounded by pronator teres. This is the pronator teres. So this is the lateral border of pronator teres. This is the medial border of the pronator teres. So here the medial boundary of the cubital fossa is formed by lateral border of the pronator teres. Yes, the medial boundary of the popliteal fossa is formed by lateral border of the pronator teres. Yes. Now, lateral boundary. Lateral boundary is formed by medial border of brachioradialis. Here. This is the lateral wall, right? This lateral wall is formed by brachioradialis muscle. Medial border of brachioradialis muscle. Yes. Medial border of brachioradialis muscle. Whereas medial boundary is formed by lateral border of pronator teres and lateral border is formed by medial border of brachioradialis. And now base. The base is formed by an imaginary horizontal line rather any muscle. Yes, it is formed by imaginary horizontal line. See, the imaginary horizontal line that is adjoining two epicondyles of the humerus. The humerus, the lower end of the humerus is containing two epicondyles, right? So, by joining these epicondyles, we get an imaginary line which makes the base of cubital fossa. Yes, this is the imaginary line that forms base of cubital fossa. And apex. The apex is formed by meeting point of lateral and medial boundaries. Yes, the apex is formed by meeting point of lateral and medial boundaries. Lateral boundary is formed by what? Brachioradialis. Whereas medial boundary is formed by pronator teres. So, where these two muscles are meeting, that point is the apex. So, here, this is the pronator teres, medial boundary, and this is the brachioradialis, lateral boundary. The point where these two muscles are meeting, it is a apex. Yes, this is a apex. The point where brachioradialis and the pronator teres, the lateral border and medial border are meeting, that forms the apex of cubital fossa. Base is formed by imaginary line. Apex is formed by meeting point of medial and lateral border, that are pronator teres and brachioradialis. Yes. Now floor. Floor is formed by two major muscles, brachialis and supinator. The floor is formed by brachialis and supinator, and roof is formed by deep fascia. That is bicipital aponeurosis. In the previous lecture, I have said that the bicipitalis muscle is inserted as tendon as well as aponeurosis. It is not only inserted as a tendon, but it is also inserted as aponeurosis. So, the roof of cubital fossa is formed by deep fascia, that is bicipital aponeurosis. Yes, these are the boundaries. What are the boundaries? Medially, it is formed by pronator teres. Laterally, by brachioradialis. Base is formed by an imaginary horizontal line joining two epicondyles of the humerus, and apex is formed by a meeting point of lateral and medial boundaries of cubital fossa. Floor is formed by brachialis supinator, whereas roof is formed by deep fascia, that is bicipital aponeurosis. Now let's see the contents of cubital fossa. See, if we want to see the contents of cubital fossa, the elbow should be flexed slightly. Yes, on flexing elbow, we can see the contents of cubital fossa. So, what are the contents of cubital fossa? There are four main contents of cubital fossa. From medial to lateral, either you see from lateral to medial or medial to lateral in sequence. So, from medial to lateral, we have four main components. What are those? They are median nerve, brachial artery, biceps tendon, and radial nerve. These four are the main contents of the cubital fossa. Yes, median nerve. The median nerve is present between two heads of pronator teres. The pronator teres muscle containing two heads, a humeral head and the ulnar head. Here we go. This is the pronator teres muscle, right? See, this is one head and this is another head. This is the humeral head and this shaded part, orange shaded part, is the ulnar head. So, this is the median nerve. This is a median nerve. It is present between two heads of the pronator teres. Yes. And second content is brachial artery. Yes, the brachial artery. We have completed brachial artery. Go check the video. So the second content is brachial artery. It is a continuation of axillary artery and divided into ulnar and the radial artery at the level of neck of radius. Radius is containing a neck. So at that point, brachial artery is divided into ulnar artery and the radial artery. So the second content is brachial artery. It terminates in the fossa. Yes, it terminates in the fossa, where at the neck of radius, by dividing into radial and the ulnar artery. Ulnar artery is presented deeply, whereas radial artery is presented superficially, and it is accessed for measuring pulse. Yes, and now what is the third content? The biceps tendon. Biceps tendon. As I said, the bicipitalis muscle is inserted as biceps tendon and also aponeurosis. So the content is biceps tendon. It is attached to radial tuberosity. Yes, it is attached to radial tuberosity. And the fourth content is radial nerve. The radial nerve is the fourth content that is presented most laterally. As I said, these are the contents we are seeing from medial to lateral. So the most lateral is the radial nerve, is presented most laterally in the cubital fossa. In the cubital fossa, the radial nerve is divided into superficial branch and deep branch. Yes, it is divided into superficial and the deep branches. See, this is the median nerve. It is present between ulnar head and the humeral head of the pronator teres. This is the median nerve, and this is most medial, right? This is the most medial side. This is the lateral side. So most medial component is medial nerve. Then next one is, this is a brachial artery. This red color is the brachial artery. Yes, at the level of neck, it is going to divided into radial artery and the ulnar artery. This is the radial one, radial artery, and this is the ulnar artery. So at the level of neck of radius, the brachial artery is going to divide into radial artery and the ulnar artery. And next to that, this is the biceps tendon. This is the biceps tendon. Yes, and the lateral most component is the radial nerve. This is the radial nerve. Yes, the radial nerve is dividing into deep and the superficial branches in the cubital fossa. Yes, what are the main components? They are medial nerve, brachial artery, biceps tendon, radial nerve from medial to lateral. You can write from lateral to medial or medial to lateral. But you have to write in sequence, either that or this. From medial to lateral, median nerve, brachial artery, biceps tendon and radial nerve. From lateral to medial, the lateral most component is radial nerve, biceps tendon, brachial artery and median nerve. Yes, these are the contents of the cubital fossa. This is complete discussion on cubital fossa. If you have any doubt, please comment in the comment section. Support the channel and like the video. Subscribe to the channel. Namaste.